Have you noticed a recent change in your child's behavior? Are they having trouble getting along with friends? Are they unable to speak? Is this new behavior affecting your family? If you are concerned, remember that your child's doctor can help. They may also suggest that your child see a mental health or behavioral specialist. Today we'll be talking about one such service known as Intensive Behavioral Health Services, or IBHS. Some scenarios include missing developmental milestones, delayed communication skills, displaying aggressive behavior, and other behaviors you may be concerned about.
IBHS is an individualized behavioral health service for children and adolescents. A team of trained professionals work with children and families to address better coping and functional skills related to mental health and autism diagnoses. Services wrap around in-home, school, and community settings based on written order and assessment recommendations. Generally, all IBHS services are designed to teach children skills needed for success. Services help increase coping strategies and support skill development to promote positive behaviors. They do so by developing a plan of care and support which involves the caregivers, educators, foster and kinship care, and others meaningfully involved in a child's life and development. Applied Behavioral Analysis, or ABA, is a type of IBHS services. The services are evidence-based and are data-driven. You might think that ABA is only for kids with autism, but kids with other diagnoses can qualify. ABA services explore why a behavior occurs and then uses interventions based on this information. IBHS services are delivered individually, in groups, and/or center-based locations, and children can get more than one type of service.
IBHS is available to children with a behavioral health condition. Services can start upon diagnosis. Usually, it will be for a developmental delay or a behavioral health concern which is screened as part of a child's pediatrician visit or school entry. Services are delivered during childhood, up to age 21. Services can be delivered as long as needed, with regular reviews to determine continued need. Behavioral consultants, or BCs, are the leaders of the child's care team. BCs develop treatment plans and complete assessments. They monitor the work done by the behavioral health technician, or BHT, and work with the families and caregivers to build skills. Other IBHS team members could include licensed behavioral health consultants, board-certified behavior analysts, behavioral health technicians, and/or mobile therapists. Mobile therapists could be used to provide therapy to a child, youth, and family to process feelings and emotions within a home and community setting, and can be used to help a child, youth, or young person process emotional difficulties, trauma, and behavioral health problems. Along with professional support, family and school daycare support and participation is key to successful treatment. Family members are expected to participate in treatment and follow the recommendations of care. IBHS team members are not to replace the child's caregivers, but to help support and guide the family to lasting care.
The first step to get IBHS services is to get a written order. This can be completed by a primary care doctor, a specialist, or one of Magellan's in-network providers. There's a form on Magellan's website that your healthcare specialist completes. Families should give the written order to an IBHS provider to begin providing services. Written orders are good for 1 year. The next step is the IBHS provider will begin with a comprehensive assessment of need and a treatment plan. The younger the kids are when starting treatment, the longer the parents have this skill set to apply with them. Services can be supplied in your home, at your child's school, at a provider's office, or in the community. Having someone come in your home can be difficult, but the benefit is great. However, the shortage of behavioral health professionals coupled with the increased demand for services means it can take time to get services initiated. Please be patient. And be sure to communicate changes in your child's behavior to your provider while waiting for services to start.
Magellan is available 24 hours a day to coordinate support for families during this process. This includes the option to file a complaint or a grievance if you disagree with the provider's approach or Magellan's authorization. Families can also request a second opinion. Our website includes a provider search tool and information about how to contact member services for each county we serve. We understand that this process can be challenging, especially with an increase in demand for these services. Hopefully, this overview of IBHS has been helpful. For additional resources, please go to our website on the IBHS members page to find service descriptions and other helpful documents for families. If you have any specific questions, please send an email to ibhs@magellanhealth.com.